folks, welcome back to the program. You saw the weather there. And once again, we're waiting for the weekend. We can't wait. Well, hey, it's a great look Monday because we want you looking great. And that's why we have Dr. Todd Shatkin from Aesthetic Associates with us this morning. Doctor, nice to have you back in.
Good morning, John.
Haven't seen you in a while. How are things going?
Everything's going great.
Go ahead.
I just returned from Orlando, Disney World, where I presented the mini dental implant conference to about 40 dentists down there.
Get out.
Which was great. Yeah, I train dentists around the country how to do these.
Is Buffalo on the forefront of this technology?
Well, yeah, I started it about 10 years ago, and of course, I have my patented procedure that I got patented about 7 years ago. So, yeah, so I think we are on the forefront.
That's wonderful. That's something we can be very proud of ourselves over.
Yeah.
That's great. Now, we were talking before going on about the difference between conventional and mini implants. What is the difference?
Well, we're talking about replacing missing teeth, and you can do it with a number of different options. Some people wear partial dentures or full dentures. Some people have fixed bridge work done to replace missing teeth, and then there's implants. And when you talk about implants, you have really two different styles of implants are popular these days. One is the conventional large diameter implant. This is approximately a 4-millimeter diameter screw that gets placed in the bone. In order to do that, you have to do an osteotomy of the bone where you make a large hole, a series of holes in the bone, and you have to reflect soft tissue or make an incision, and it's a surgical procedure. It's a surgical procedure,
right.
And then what you do is you bury that implant for approximately 4 to 6 months and allow healing. After that, you go through a second surgery where you go back and open the gum up again.
Oh my.
And then put an abutment and a restoration on top of it. So that procedure typically takes anywhere from 6 months to a year to complete.
Is that still being done?
It's still being
done.
Yeah, still being done. Actually, the majority of implant dentists are still doing it this way. Okay. And they also often require a bone graft or a sinus lift procedure to accomplish that procedure.
Oh my goodness.
So that could be a third surgery.
Well, we definitely want you to give us a call at 644-9840 if you have a question for the doctor concerning this implant procedure. And I just found out this morning myself that we in Buffalo started the mini implant procedure. Well, now, the mini implant is a smaller version of the conventional with no surgery, right?
Yes, the mini implant is approximately 2 to 2.5 millimeter diameter implant. And these are placed without cutting the gum open in a non-surgical procedure using my patented procedure, which I developed about 7 years ago, to place these implants and permanent restorations in 1 or 2 visits.
We have some pictures this morning we want to show you. I guess the first one is a person who, only has half of their teeth on the upper part?
This patient had a traumatic injury and lost half of the upper teeth. And you can see had the remaining teeth in her mouth. And so what we did is we placed mini dental implants, and you can see them there, without surgery, through a little pinhole in the gum. We placed them all in 1 visit without the need for a sinus lift or bone graft procedure. Okay. And within 2 weeks, this patient had her permanent teeth replaced.
Look at that. And you'd never know.
And the advantage here is you can load these immediately. They can be placed in 1 visit, and the crowns can be put on the same visit. So it can be done in 1 or 2 visits. And the mini implants, we've done them for 10 years now. We've had over 95% success with them, and I've done almost 10,000 of these.
Are you serious? That many? That's incredible.
And they're really working out beautifully.
Now, doctor, once the implant is in place, and is it each individual tooth is put on the implant, or do you create a bridge?
When we do multiple next to each other, we normally connect them together for strength.
So it's like a bridge. That would have been a mini bridge.
Right, it's a cemented bridge.
I noticed in that final picture that the new teeth are actually the same coloring. She has slightly discoloration near the gum or something. Yeah. You even match that with
we have our own lab right in our building, and we do the staining and glazing right there, and we do this work for dentists all over the country and even outside of the United States. We have about 1,500 dentists who send their own cases to Buffalo to have our laboratory make their crowns.
That's incredible. We have a phone call. Good morning. Welcome to the program.
Good morning.
Hello.
Good morning.
Yes.
How are you?
Fine.
I have a question. I had a root canal 3 years ago on one of my back molars. I started forming an abscess on where that root canal was performed. I'm wondering if I should have that tooth removed after I finish the penicillin, and would I be a candidate for the mini implant? Or what should I do next? I just don't know.
It's hard to answer that, on the phone, obviously. I'd have to take a look at your x-ray and examine your mouth, but it's possible if the root canal is failing, you may be a candidate to have that tooth extracted and then have an implant, a mini implant placed after that. So, but I would suggest you go back to the dentist probably who did the root canal if it was recently done and figure that out. If you want, I'm always available for a second opinion.
Do you have people come to you that have as few as one tooth replaced with this procedure?
Yeah, in fact, the other procedure I was going to show, which apparently we had some technical trouble, but is a single tooth replacement. So we do anywhere from one tooth up to the whole mouth of teeth. We can do anything in between 1, 2, 3, up to 24 teeth.
In that second picture with the mouth open, we saw all the implants in place, and then you said you made a bridge of teeth that fits right on that. Right. Does that ever come out, or do you leave that in forever?
This is cemented in permanently.
Now,
the other option for people who suffer from loose dentures is to put the mini implants in to help stabilize their loose dentures, and then they can snap them on and snap them off.
Okay, and we have another call. Let's go to the phones. Good morning. Welcome to the show.
Good morning, Dr. Shatkin.
Good morning.
John,
good morning.
Is it possible to have this type of surgery done when you've had knee replacements, such as I have had, or would you get infection?
No, you definitely can have it done with previous knee replacement surgery or hip replacement. There's no problem there. We always put our patients on an antibiotic anyways, and of course with the knee replacement we would start you on that the day before, so you take it for a day in advance and then take it for a week afterwards. But we've never had an issue with anybody developing infection in any joint replacements from the procedure.
Boy, that surprised me. I didn't expect that question. The knee's pretty far from the mouth, but
well, it's because there is a connection through the blood.
Through the blood,
and if you get an infection, it can spread.
I think I'm being told we have that second set of pictures. So if we can take a look, this is the one where you did simply one tooth.
Exactly. This is a patient with one missing front tooth. We put the mini implant in, and let's see the next slide. If we have it.
Okay, there we are.
Okay, so there's the area where the space is.
Right.
And there it is after replacing the missing tooth.
That is amazing. People must light candles for you guys.
And a big advantage here is a few years back you'd have to grind down those healthy teeth next to that space.
Yeah.
And now we can do it without touching those teeth.
All right, we have another phone call. Good morning. Welcome to the show.
Is this procedure done in just one visit? You don't have to come back, or you get the implant and then the tooth later?
Yes, you can have the procedure done in one visit. You'd obviously have to come in for consultation. We'd take the necessary impressions and x-rays, and then about 2 weeks later you'd come in and have the procedure done in one visit where we put the implant and the crown in. Correct.
Now, doctor, how long does it take?
You would have to come back for follow-up, obviously. I want to keep an eye on things and make sure everything's perfect.
Of course.
But yeah.
How long does it take your lab to match the teeth that's going in to look like the rest of the mouth?
Well, that's done during that 2-week interim while the patient's out of the office after we take the impressions, and the lab makes the crowns and the surgical guides and everything that's done. And if we need so, chairside, we can actually have a lab tech to come and color it to make it even more perfect.
That is incredible. Doctor, thank you so much. This was very exciting. I'm glad we got to that second set of pictures. That fellow's got to be very happy. Aesthetic Associates Center, plastic surgery and dentistry. You can give them a call at 839-1700. And they're located at, is that 2600 Kensington Avenue? 2500 in Amherst, New York.
And we offer complimentary consultations.
Complimentary consultations. So if you need this procedure, you can see Dr. Shatkin.